One reason eating disorders are so difficult to treat is that patients' troubled feelings about their bodies can be so hard to unravel. And it's all the more difficult when the patient is not an adult or even a high schooler, but a young child. And yet, a government study covering the years 1999 to 2006 revealed the shocking fact that hospitalizations for eating disorders increased most sharply by 119% for children younger than 12 years old. Here's Andrea Canning.
This is Taylor Call, an active 6-year-old pre-K student who lives outside Houston. A year ago, Taylor came home from school and said something that shocked her mother, Tanya.
We were at home and she just, out of the blue, just said, "Mommy, why is my tummy so fat?" And it took me back, and I asked her, "Well, why are you asking me this?" And she said, "Because a girl in the bathroom at school asked me why I was fat."
Do you think sometimes your tummy is too big?
Sometimes. Sometimes.
And you want to lose weight in your tummy?
Yeah.
Why do you want to lose weight?
Because I don't like to be like my way, and my teacher always tells me that I have to run so I can be really not like this size.
Just 6 and already feeling bad about the way she looks.
Okay, let's go see how much you weigh.
We went with Taylor for a visit to her pediatrician, Dr. Rachel Bray, to check whether or not Taylor is even overweight.
When we use her height and weight to calculate her body mass index, it's completely normal. She is not considered overweight at this time.
You're silly.
Tanya says they try not to focus on weight, but the messages Taylor gets from her peers definitely have an impact. At a recent birthday party, a young boy called Taylor fat girl. Tanya confronted him and explained it was unkind to speak to people that way.
I think that was a good way of showing her how to handle something like that. I'm sorry.
What's alarming is that increasingly younger children are beginning to form unhealthy body images of themselves, which can lead to trouble. A recent study by the University of Central Florida found almost half of 3 to 6-year-old girls who participated said they worried about being fat.
There's no question we're hearing from families with younger and younger kids who are struggling with disordered eating or formal eating disorders.
Dr. Evelyn Adia runs eating disorder programs at Columbia and Weill Cornell hospitals.
In a recent study, we found that much higher rates of hospitalizations are utilized by our youngest patients, ages 10 to 12. This is a change. This isn't what we've always been seeing.
She points out that while there's no direct link between playground teasing and the development of an eating disorder, her patients often have painful memories about their bodies and their weight that date back to early childhood.
Those with eating disorders will often have a narrative of their life that does describe the high value placed, the high salience placed on some early experiences in which someone may have said something, in which someone may have called them fat or identified something that might have been wrong with their body.
Karen is one of Dr. Adia's patients who has been struggling with anorexia since she was a child. She remembers her thin older cousins bringing her clothes she couldn't fit into.
They'd laugh and they'd say, "Oh, the oldest one wore that when she was 18 and you're 10. Isn't that something? Isn't that funny?" And that made me feel bad. In that I just never felt normal or thin. And I think part of that does trace back to that kind of incident.
We gathered a group of girls ranging in ages from 5 to 8 years old to get their perspective.
Why do you want to eat healthy?
Because you are going to get strong, so you don't get fat.
How do you feel about people who are overweight?
I feel sad about them.
You feel sad if someone's overweight?
Yeah.
How come?
Because they're so heavy.
Do you ever hear your moms talk about their weight?
My mom, she says that she needs to go to the gym because she thinks she's overweight.
What do you think when you hear that about your mom?
I don't think it's true.
Why do you want to eat healthy?
Not to get fat. So I don't get heavy so my dad could carry me. When you eat more and your tummy is full, you're going to pump.
We showed the girls some photographs.
The first picture I'm going to show you is a little girl who we met in Texas, and she thinks that she needs to lose weight. Do you all think that she needs to lose weight?
No.
Do you think she looks good?
Yeah.
But they were not always as kind.
What do you think about this girl?
Oh, she has to lose weight. Yeah, she needs to lose weight.
Do you think someone like her might be teased at school?
Kind of. Sometimes.
4 girls here. Do any one of these girls stick out to you?
Wait.
Which one? Which one sticks out?
The girl in the blue.
The girl in the blue. Why?
Yeah, her tummy. Her tummy's like
Her tummy.
the girl in the blue shirt is really chubby. Yeah.
Their reaction may seem lighthearted enough, but this is the age where a lifelong struggle with body image begins to take hold.
With Taylor worrying at such a young age about her body, are you worried that this is going to develop into an eating disorder when she gets a little older?
I'm not going to say that it won't or it can't, but I feel if we deal with these issues head on, it won't, or I'm hoping it won't.
And by often repeating how healthy and pretty Taylor is, her mom hopes that she will grow to have a positive image of herself, despite all the pressures around her. For Nightline, I'm Andrea Canning in Katy, Texas.
Our children at risk there. Thanks to Andrea Canning for that important report.